Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Lagos State Commissioner for Health says mass vaccination in Lagos is to avoid a fourth wave of the pandemic. Residents in Yobe State lament effects of the pandemic on businesses. For the first time since early 2020, the United States allows fully vaccinated people to fly in. Kaduna State led the COVID-19 infection charge with 41 new cases, followed by Lagos with 24. The Nigeria Center for Disease Control, NCDC, in its report last night says 86 people tested positive on Sunday. The latest positive samples were recorded in 7 states, a similar situation the previous day, but with 116 cases recorded across Nigeria. Meanwhile, the FCT still has the highest number of cases on admission at 2,058. Here's more on the update.
86 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and indicate a drop from the figures reported 24 hours earlier. 41 cases came out of Kaduna State, while Lagos recorded 24 and Osun 10. Bauchi recorded 6 cases, Ekiti and Ondo have 2 each, and Edo State recorded 1 case. Today's report includes a backlog of cases from Lagos State. No cases were reported in Delta, Kano, Ogun, Oyo, Plateau, Rivers, Sokoto and Taraba states. The total caseload in Nigeria has risen to 212,713. 130 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 204,379. There was 1 additional death from COVID-19 complications reported in the last 24 hours, raising the total number to over 2,900. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received a first shot of a COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.2 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 219,000 deaths recorded across countries on the continent. More than 249 million people all over the world have contracted COVID-19, while deaths are over 5 million.
In Yobe State, residents have lamented the devastating effects of the COVID-19 pandemic on their businesses, calling on government and private firms to invest more in the sector so as to recover. Speaking to some scholars in the state capital, they describe entrepreneurship as the only solution to the loss of jobs and the challenges posed to the economy.
Many have lost jobs since the outbreak of COVID-19 in Nigeria. Businesses have also faced setbacks owing to lockdown in most states. The National Bureau of Statistics reports that about 20% of full-time workers have been affected, while business activities slowed down, crippling the economy of many.
The COVID-19 caused a lot of havoc to us because things are not like before. Even some people who are coming to buy, they are not coming, and some will even come and buy on credit. They may not be able to pay. So it affects our business seriously.
These scholars of Federal Polytechnic Damaturu in Yobe State at its multidisciplinary conference believe investing more in entrepreneurship can curb the socio-economic challenges faced during the COVID-19 pandemic. The conference, which is holding virtually with participants across the country, aims to find ways of mitigating COVID-19 through entrepreneurship.
If a student from the Polytechnic graduates, let's say from office technology management, he or she must have acquired competence in handling process of writing documents, presenting documents, making photocopy, and so on and so forth. So if government can provide soft loan to this category of student, it will give them opportunity to be independent. They can open a business center and run a very comfortable life out of it.
When somebody is self-employed and he generates income for his own benefit and also employed other people's, many of those people that have lost their own, jobs will be employed by these new schemes that were introduced in the institutions, train and retrain the other peoples.
Yobe State now has 502 confirmed cases, 9 deaths, with only 3 on admission, 1 in every isolation center across the state.
An aggressive vaccination campaign is necessary to avert a fourth wave of the COVID-19 in Lagos. This is the submission of the Lagos State Commissioner for Health, Professor Akin Abayomi, who has been explaining his reason for wanting to get 4 million Lagos residents fully vaccinated before the Yuletide. Professor Abayomi was speaking on the sidelines of the Climate Change Conference, COP26, currently taking place in Glasgow, Scotland.
We've done a lot of work modeling how these waves start, what are the trigger factors of each of the 3 waves. And we've understood very clearly that it coincides with movement of people. So it coincides with holidays, either the Christmas or the summer holiday, where there's a sudden movement between parts of the world that have high numbers of COVID and these evolving variants of COVID. So having gone through the 3rd wave now, we're now in a low area, so we're out of the 3rd wave. We are anticipating that there's going to be a large movement of people into Nigeria, particularly Lagos, since Lagos takes most of the volume of air travel into Nigeria. We know that another epicenter is evolving in Europe with the Delta Plus variant. So we are now planning very significantly on how to manage this movement of people into Lagos and Nigeria around the Christmas New Year period. And that is going to start somewhere early December. So if we don't become aggressive, we may go into the 4th wave. So what we're doing in Lagos now is to anticipate what may happen and to plan ahead to make sure that we have certain strategies in place that are going to mitigate this 4th wave. So what are we doing? The first thing we're going to do is to make vaccines accessible to all Lagosians and in every local area. So we're involving the private sector now in the administration of very large numbers of vaccines. We're going up to 8 million doses, courtesy of the federal government, who have made these vaccines available to us. Making vaccines available to you is just one aspect of it. The logistics of distribution is a major feat. Before we were driving the vaccines through the public health service, which has limited capacity to reach the entirety of Lagos. Now, 70% of Lagosians access their healthcare in the private sector. So it makes a lot of sense to involve the private sector in the administration of vaccines to all Lagosians.
Joining us for more about Lagos's feat, and that's vaccinating 4 million before the Yuletide. Dr. Ajoke Adewale, a public health physician, joins us from the United Kingdom virtually. Thanks for joining us on the program.
Thank you for having me.
All right, just before we talk about Lagos, let's talk about where you are in the UK. I mean, that's a country that has almost everyone vaccinated. I mean, what does it feel like?
I mean, definitely people are beginning to relax off the masks, but it's because they've been vaccinated. You have a lot of vaccination areas, a lot of support. I mean, I volunteered with the NHS, so I'm one of the steward volunteers at the vaccination centers. So almost everyone here is vaccinated, and it's making it easier to, relax the COVID-19 lockdown measures in terms of, the masks and the rest. So it's a good feeling. Feeling of being protected, and even regular healthcare staff get tested weekly. So on a weekly basis, you just get your swabs delivered, you do the test yourself, you drop it, and every week you get a message to know what your results are. So despite being vaccinated, you get monitored and you get all the support you need. It's a nice atmosphere, yeah.
That is quite interesting. But let's talk about Lagos, the efforts of the government trying to vaccinate 4 million before the Yuletide. What do you think? Especially also having private hospitals begin to dispense the vaccines for a fee.
Yes, well, I applaud the efforts of the government. It's quite ambitious, seeing that the Yuletide season is already here. We have to we have to admit that Lagos State is a different environment, different from other states in the country, and also different in the sense that it's the economic center. So it is very overcrowded. The WHO suggested or requested that countries should aim for 40% vaccine coverage, and we are still way above and way below. We are around 3%, so we're not even where we need to. So working with the private sector, I think that it is it's innovative. It's a good thing. It's something that should be applauded, because we know that a great chunk of the health sector is driven in the private arena. So in as much as people will come to the public, many people would find it more convenient to visit their private health facilities. So I think it is a laudable, innovative way to make sure that people everywhere can get it at their comfort.
What do you think are some of the challenges that we might face, especially in the modalities for the exercise? And there's also the fear, what if vaccine hesitancy gets in the way? Because this will in turn affect the potency of the vaccines, wouldn't it?
Well, I know that the first thing would be to criticize the fees being put on the vaccine, being associated with getting the vaccine in the private hospitals. So many people are going to criticize that, but the government has explained that it's for administrative costs. This money is to be paid through the government website, and that all the processes of quality control will be ensured. The obvious challenges I just see is to make sure that those quality control are indeed enforced. We want to make sure that the same standards that are being observed in public vaccination centers are what are being observed. You want to make sure that the cold chain is being the cold chain is what makes vaccines potent. So we want to make sure that even when these vaccines are in the private facilities, they are still potent, they are maintaining the cold chain, there are no corruption practices. Hospitals that are not regulated do not get it, and they do not inflate the prices or the rest. It is doable. I mean, over here, you find out that pharmacies, several places, universities, a vaccination point, although it is free, but we have to compare these things carefully. So I think that the obvious challenges is just about definitely the fact that corrupt practices, maintaining cold chain, ensuring quality control while we are giving private facilities, and making sure that people are not going behind the system, which still boils down to the corruption I mentioned, so that they get this vaccine. They don't turn this vaccine into a profiteering event.
All right, we'd like to appreciate your time. Thank you so much. Dr. Ajoke Adewale is a public health physician joining us from the UK. Stay safe.
Thank you.
The COP26 Climate Summit is one of the first major global gatherings to be held during the pandemic. International lawmakers, business leaders and activists are convening in Glasgow, the UK, for the second week. Delegates were asked to accelerate action on climate change and commit to more ambitious cuts in greenhouse gas emissions, all in an effort to limit global temperature rises. Well, the event has seen organizers implement a raft of antivirus measures, including daily testing, mask-wearing requirements. According to the organizers, the safety and security of everyone at COP26 and the surrounding community is of utmost importance. Our correspondent, Ayola Kasim, who is covering the meeting, joins us now virtually. Hello, Ayola. First, tell us about the protocols with such a number of people that have been attending.
Hello, Melissa, nice seeing you. The thing is, you wake up in the morning, you have to do the test. You get an email saying that you have to scan your test and then report to the NHS saying that you're positive or negative. You get an email. It's with that email that you access the venue. Without that, you cannot access the venue. You must report your test. And then the first thing you get when you come in is the LFD. There's the lateral flow test kit. You get 2 of this every morning. You have to do that. And then you also get the PCR test kit. So if you don't have any of this, you cannot access the blue zone. The blue zone is where major action are taking place, like the board leaders and everything. This is where they are. So if you are negative, you cannot access it. But there are 2 zones. There's the blue zone where the leaders are meeting, and then there is the green zone where the youth and the climate actions and everything is taking place. You can go there without your test, but to access this place that we are, where the main action is, you must pass the, you must have a negative COVID-19 test.
Result. But, you know, Ayola, it's also mind-boggling that with all of these protocols, over the weekend we heard about some delegates coming down with COVID as well. And so one begins to wonder, what is it with the virus, or is it with the preparations that the virus, some people still caught the virus?
Well, remember, like, before you leave your country, the UK has made it that you can come in, if you're vaccinated, you can come in. But some people still did the PCR before coming, making sure that they didn't come here with the virus. But then on their way in the plane, you can be exposed to it, or within the country itself, you can be exposed to it. Or you go to the green zone, for instance, as I said, nobody is testing, you can be exposed to it. But from what we heard from the COP president, Alok Sharma, he said the number of people that have been affected, that have contracted COVID in the blue zone is way less than those in the green zone or around the country. So in some ways, there's been an adequate measure for those people coming into, the delegates coming into where the main action is, which is the blue zone. It's not as rampant as those in the green zone, or in the, is not like the country average, for instance, way less. That's from what we heard from the president of the COP.
So, Ayola, have there been any mention of COVID-19 rather than just climate change? I mean, people said the lockdowns earlier last year reduced the emissions, and, you know, the breathing and, you know, breathing air was sort of significantly cleaner and clearer.
Yes, with the lockdown, the economies, remember, even in Nigeria, we had a lockdown, and then what came out of it? We had cleaner air, and then, you know, more people are not flying about. So it was with clean air that is good for the environment, but then the economic benefit of it, the downside of it, people were going hungry. Remember what happened in the country where people had to go and they had to go and damage some area. They had to go and loot some warehouses across the country. Remember then? So that is not good for most economies. So they had to open up. But then people were talking about vaccine, making vaccine available for everyone around here. Making sure that everybody have access to vaccine. So they're talking about that. It's taking center stage at some of the conversation here. The NGOs, the CSOs, everybody is talking about it, that it should proliferate. They shouldn't just limit it. They should bring down the cost such that developing countries or poorer countries can have access to it. I mean, you will remember even the Nigerian government is trying to. I was told by the Lagos State Commissioner for Health that it took us 6,000 naira now in some private hospitals to have access to vaccine. So they're trying to make sure that it's more accessible to more people, and then making sure that more people have access across the globe. So it's also a conversation that people are willing, because without the vaccine, and some people are not able to come here to have a conversation on climate change, and it's an important one that everybody must come around the table to make sure that we have a way out of the climate crisis that we are already in.
All right, thank you so much. Our environment correspondent, Ayola Kasim, there for us at Glasgow. Thank you and stay safe.
Thank you very much.
Meanwhile, the United States today reopened all its borders to vaccinated individuals from about 33 countries in the world, ending a 20-month travel ban just as Europe battles a rise in COVID cases. The reopening means families and friends separated since the start of the pandemic can now be reunited with loved ones for the first time in months. Here's more on the global update.
Travelers excited at the prospect of seeing family and friends in the United States for the first time since the pandemic started took off early on Monday from London following the lifting of U.S. travel restrictions. The extraordinary U.S. travel restrictions, first imposed in early 2020, had barred access to non-U.S. citizens traveling from 33 countries. From Monday, travelers who can show official proof of vaccination against COVID-19 and have had a recent negative viral test can fly to the United States.
So when the Biden administration announced that the U.S. border will be opened, we saw a 600% increase. The flights today are full, of course, over the next few days. So it has a major impact between announcement, between the opening and what we're seeing. And people are starting to book for, of course, actually November and December, so what we call near-in bookings are high, as you can imagine, which tells us that there is pent-up demand of 2 years yet to fly to the U.S. and elsewhere.
The wait is over in Germany after 20 months of being banned from entering the country. Tourists and business travelers are allowed to fly to the U.S. again. Crowds gathered at Frankfurt's Lufthansa check-in, as well as in Paris and London. For Germany's largest airline, flights to the U.S. are a lucrative business. In November alone, Fraport expects up to 400,000 more passengers because of U.S. travel. It is the same for excited Belgian travelers who checked in for flights to the United States on Monday as the U.S. lifted travel restrictions for foreign passengers, with many facing the prospect of seeing friends and family for the first time in 20 months. The restrictions, first imposed in early 2020, had barred access to non-U.S. citizens traveling from 33 countries, including China, India and much of Europe, and had also restricted overland entry from Mexico and Canada. The extraordinary U.S. travel restrictions, first imposed in early 2020, had barred access to non-U.S. citizens traveling from 33 countries, including India and much of Europe, and had also restricted overland entry from Mexico and Canada. Travelers who can show official proof of vaccination against COVID-19 and have had a recent negative viral test can again fly to the United States.
Adherence to all non-pharmaceutical preventive measures of COVID-19 will help to curb the spread of the pandemic. Continue to take responsibility. You can visit our website for more updates, breaking news and several other stories. It's at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.